joining us will be Bonnie Kruska. This is the first time Bonnie is going to be joining us. She is the Vice President and Chief Nursing Officer for Ambulatory Services for Munson Healthcare. And for those of you who don't know, the word ambulatory simply means that care is provided outside of a hospital setting in a location such as a doctor's office or one of our community health centers. So anything not actually in a hospital, which is very relevant to today's conversation, as many of the vaccine distributions are done outside the hospital setting and will be eventually transitioned to some of the doctor's offices. So now, before we introduce Bonnie, I'd like to introduce Dr. Christine Nefsey, again, Chief Medical Officer for Munson Healthcare, to give us an update on our current COVID-19 numbers in the region. Dr. Nefsey?
Thank you, Diane, and thank you everybody for joining us. So just a review of the numbers. You can see for our Northern Michigan region, we are cumulatively at 22,494 cases. That number continues to go up. I think most people will recall last week we had a fairly significant uptick in our numbers. That has gone back down about half as much as where we were, and we seem to be holding in a steady state right now. So certainly manageable, but something that we are absolutely keeping an eye on. Next slide. You can see here also our number of inpatients. That is the number last week that between Monday and Friday nearly doubled. It has, like I mentioned previously, gone down a bit, and we are holding steady, but we continue to see a good number of inpatient COVID positive patients in our hospitals around Northern Michigan. Next slide. You can see here the graphic. So, you know, we had that big uptick, a gradual decrease, and then you can see there that little blip of what we saw last week. Next slide. This is from the CDC. So this slide just shows you where we are for visits in the emergency department for COVID-like illness versus influenza-like illness. We've received quite a few questions about the level of influenza in our community. It has been exceedingly low, certainly well below what we would typically see in a year. So if you look at those blue-green lines, those are influenza-like illness. So you can see at the beginning of the graph last winter versus this winter. And then that orange line is the COVID-like illness. And so you can see quite a difference between last winter and this winter. Next slide.
Great, thanks, Dr. Nefsey. We'll have you back for the Q&A shortly here, but next it's my pleasure to introduce Bonnie Kruska. Again, Bonnie is the Vice President and Chief Nursing Officer for Ambulatory Services for Munson Healthcare, and Bonnie has played an instrumental role in standing up the Munson Healthcare vaccine clinics. And Bonnie, I'm excited to have you share an update.
Thank you, Diane. So sorry about that. And thank you for inviting me to this forum to talk about COVID-19 vaccination effort at Munson Healthcare. So next slide, please. I thought I'd start by talking through the guidance given by the Michigan Department of Health and Human Services, MDHHS. The initial operation goal was to vaccinate 70% of Michiganders over the age of 16 and older by the end of 2021. And really to achieve this goal, MDHHS outlined a strategy for vaccination prioritization for the state, which is essentially the roadmap for public health officials and healthcare systems to allocate and administer vaccine. So with that said, locally, we're working very closely, thank you, with our public health colleagues and our regional health departments to offer COVID-19 vaccine to our communities based on identified priority groups. Next slide, please. Next slide, please. So this preliminary vaccine, thank you. This slide shows the preliminary vaccination timeline for moving through the CDC phases, but as many of you know, this is the guidance changes as information evolves and more vaccine types become available. The MHC strategy aligns with the overall CDC implementation strategy, and both of our team and the health departments are working hard to quickly expand eligibility groups and offer the vaccine to more members of our community. I think you're one slide ahead of me.
Yeah, so Bonnie, I think what we're seeing, it might be a little bit different than what you're seeing. So how about I help you out a little bit here, because I think there might be a delay.
There is obviously a delay.
Yeah, so this happens quite frequently on these virtual meetings.
Okay.
So we're looking at the vaccine timeline right now, and how, so are we still in the Tier 1A and some Tier 1B, and then also that 65 and older was accelerated, which we had announced last week. So, but I think one of the main points that we want to keep reiterating with this slide is that, this is going to continue to take some time to get to everyone across northern Michigan, right, Bonnie? This is we only have so much vaccine, and we can only vaccinate so many people at one time, right?
Right. Really, this is the overall strategy the CDC set forth, but our teams are working very hard with the health departments to kind of quickly expand those eligibility groups so we can move across this timeline and offer a vaccine to more members of our communities. That's exactly right, Diane.
Great. So next slide, please. Bonnie, this is the slide that just talks about the total population of 65 and older.
Right. So to provide some context about the scope of the vaccine effort, about 1.8 million people in Michigan are 65 years of age and older. And so within the Munson Healthcare service region, that's about 132,000 people. That's about a quarter of our population. So this eligibility pool is quite large. It's an increase more than tenfold from the pool that we had about 2 weeks ago. And there are several key factors to consider when we're talking about distribution. Supply remains limited, and future availability is still uncertain. So from day to day, we have no idea whether or not we're going to get a vaccine allotment. And so really, it's an orchestrated effort to ensure we are going to have vaccine, be able to offer a clinic, and then to ensure that we aren't wasting any vaccine. And so this takes time, and so we completely understand how eager the community is about getting vaccinated and protecting themselves from COVID-19. And so we will have more clinics to come when vaccine becomes more readily available. And so we did streamline a process here at Munson Healthcare where we think that it's pretty efficient and we'll move quickly through getting people vaccinated when the vaccine arrives here at Munson Healthcare. And so once again, we ask people to be very patient, and we'll work as quickly and collaboratively as possible with the regional healthcare departments so everyone is vaccinated.
Great. Next slide, please. So Bonnie, this one's talking about what clinics are currently open across the region and what may be opening soon.
Thanks, Diane. So this was very, very exciting. On 1/12, we opened up clinics to Munson Healthcare patients across the healthcare system. And then quickly, we kind of moved to offering it to all patients that were 90 years of age and older within our service area. We developed these clinics that were drive-through clinics to make it easier for the patients so they didn't even have to get out of their car. We piloted it last week and it went relatively well. And so we did have drive-through clinics, as stated in the slide, in Traverse City. We had one in Cadillac. We had the first one in Manistee, which is my hometown. So I was really excited to get back there and offer vaccine to our community members. We've had them in Grayling, Otsego, and Charlevoix. And we expect that Kalakaska will be having some clinics soon. So our goal was really over a 4-week time period, or excuse me, a 2-week time period to vaccinate 4,000 people. So in the first week, that we offered these drive-through clinics, we wanted to vaccinate 2,000 people, and we were able to exceed that goal. So we were very, very pleased. And so I'm excited today to announce that we're currently vaccinating people within our community who are age 82 and up, and eligible caregivers or someone in the home who resides within the same residence that may be 65 years of age and older.
So Bonnie, this is, these are criteria that change almost on a daily basis. So as you mentioned last week, on Friday, we opened it up to age 86 and above. And today, this is the big announcement, now it's 82 and above. So I think that's a really exciting development, and we're hoping to spread that word across our communities. But if we can go to the next slide, maybe we can get, you can just share some feedback of how many total vaccines Munson Healthcare has administered, and then who those people were so far.
Absolutely. So to date, our call center has taken nearly 14,000 calls, and Munson Healthcare has been able to administer 12,191 total vaccines. And like I said earlier, we launched the drive-through clinics last week. We were able to vaccinate over 2,000 community members. And then this coming week, we have clinics planned, and we do have those phone lines open and ready to schedule more community members across Northwest Michigan in our service area, beginning today, beginning right now.
That's great. Next slide, please. This is just some photos of the inclement weather, but I think the feedback that I've heard is that even though it was very cold and rainy, and we weren't sure if a lot of people would venture out of their homes to do this or want to even work these clinics, what has been the feedback so far?
Well, we've had an overwhelming response to this COVID-19 vaccination effort, and it really is so humbling to see everyone so happy and willing to be part of it. Like I said to one of my colleagues, this is kind of how we do it in Northern Michigan, right? Everyone put on their snow pants. People didn't have to get out of their car to get vaccinated. The entire process was really efficient. And most all folks are vaccinated, within 30 minutes. And so it really is a streamlined process that we have here at Munson Healthcare.
And I want to take this opportunity to thank all of the workers across Munson Healthcare who actually volunteered to be redeployed to actually staff these clinics. So these people were doing different jobs, a couple of weeks ago, and now they're directing traffic and scheduling and doing all these things. So we just want to thank all of those workers. Also want to thank all of the volunteers in the community that have helped support these clinics. And also, we can't thank enough the local police departments and the fire departments and all the local government resources who've helped with the traffic signs and the sort of the traffic management piece of it, and security and everything. This slide is just showing some of the happy faces that have come through the clinics, and again, this is why we're in healthcare. This is why we work in healthcare. This is probably one of the most rewarding experiences that many of us have had in our careers. So that's just some photos there. Next slide, please. So Bonnie, this is the slide that's just saying that we've opened it up to 82 and older. Can you speak a little bit more to some of the criteria, and before we get to how people should call or try to schedule, we want to make sure that people are living in certain counties and that they actually meet certain criteria. Otherwise, we're going to have to turn them away, correct?
Right, correct. So when people call 935-SHOT, that is the phone number. Essentially, you will be greeted by a scheduler who will confirm that you are residing within one of the service areas. And so, you have this list right there. And so essentially, we need to do that because a lot of this information is going to be uploaded into a state database that confirms, yes, I've received the vaccine. And so that's why we ask you that. We would like you to bring some form of ID, so a state ID, a driver's license, a birth certificate, to confirm that you, in fact, are that person. And you reside at that location. So we do that on the day of the clinic just to confirm.
Great, thanks, Bonnie. Next slide, please. And this is the phone number that I think everyone, most people have already seen this number. It's been shared pretty widely on social media. But again, if you do meet the age and residency criteria above, you can call 231
935.
Yes, 935 SHOT.
Shot. How could you forget that? Shot.
So I had a blip on my screen here. I thought I was losing my connectivity, so sorry about that.
Which is 7468.
Okay, so just remember 231-935 SHOT, and those phone lines will be open 8 a.m. to 4 p.m. 7 days a week. We want to just advise that the phone lines have been very busy, and that the vaccine scheduling lines will continue to be very busy, so please be patient when you are calling. And so thanks, Bonnie. I'm going to have you back for the Q&A in just a minute, but I wanted to bring Dr. Nefsi back to kind of talk about, how quickly we think we can get everyone vaccinated, and when are enough people finally vaccinated that we can finally start to let our guard down or take our masks off and get back to normal. Next slide, please.
Those are all good questions, Diane. I think it's important that people understand with one COVID vaccine, you are about 50% covered. With your second shot, you're about 95% covered. Most people are, but that is really only 10 to 14 days after that second immunization because your immune system needs time to respond. So that's, for somebody personally who is eligible and receiving the vaccine. The other thing from a general population is that we think around 70 to 80% of the population vaccinated before we reach herd immunity. So that's why we're asking for people in the interim. I mean, we've done some great work. Bonnie and her team has done some awesome work getting 12,000 of our community members vaccinated. That's a pretty small percentage of the broader population. So we need to continue to mask, we need to continue to social distance, wash our hands, all of those things we've been recommending this whole time until we're much further down the road on that, the vaccination program. I think the other thing, Diane, that we don't know yet is the new variant that we're seeing.
Right.
The good news is that the testing capability we have does test for that variant. The vaccine appears to work for that variant, but with a relatively low percentage of our population vaccinated to date, there is some concern that if we start to see widespread of that new variant, that will have a lot more people with COVID spreading it around. So, with the uncertainty around that one and what we're learning from the United Kingdom, it's again, I think, very, very important that people continue to stay the course.
Great, thank you, Dr. Nefsi. And I think that's the end of our slides. So we will ask Bonnie to join us by video again, and we'll take the slides down so we can see each other's faces a little bit better. So we do have a lot of questions coming in from reporters who are on this webinar, as well as our Facebook live stream. So I just want to thank everyone for submitting your questions. You can either submit those on Facebook if you're viewing on Facebook, and they'll get sent over to me here. Or if you are actually on this webinar, you can use the Q&A feature. So Dr. Nefsi, I'll have you address this one first, and then Bonnie, feel free to comment on this as well. This is a question from a reporter. Just by category, educators, teachers represent a huge segment of the essential worker priority groups. Can you share the plan for educators and teachers, both in Grand Traverse and regionally? There are obviously logistical challenges with the teacher's schedule and the vaccine clinic schedule availability. How do you get them vaccinated without missing class or closing schools?
That's an excellent question and completely summed up all of the logistical things that we're trying to take into consideration with that population. So we did get some good news this week in that we received all the vaccine that we requested. So we are actually working very actively with our health departments right now to try to figure out when we can schedule vaccine clinics specifically for our educators. So we hope to have more news on that this week.
Great, and I'll just reiterate too, the availability of the vaccine is really what is dictating how quickly we can move and open up criteria. So again, we just ask for everyone's patience, but we know that's a very high priority, as well as, all these other, people with underlying conditions, et cetera, that we want to try to get into these clinics. Dr. Nefsi, you mentioned the other strain, or the new strain that's coming from the UK. This question is also from a reporter. How is Munson preparing for the new strain of COVID? Do you expect an increase in hospitalizations, and will it have any effect on current vaccination efforts? And please tell us what you know about the potential for the new strain and how dangerous it might be.
Well, most of the data that we're getting is actually coming out of the United Kingdom right now. So what we know about that is that it is much more contagious, but not any more lethal. So certainly that has the potential to impact our numbers, not only our community spread, but the numbers, that certain segment of that population that could get COVID and get it significantly enough that they require a hospital care or any kind of clinical care. So we are sort of expecting that, or at least preparing for that. We don't know if that's going to be the case, but just looking at what's gone on in the United Kingdom, we're sort of assuming that potential is there for us as well. What we've done in the interim, I think I already mentioned, we double checked to see that our testing capability actually tests for the new variant, and it does. And then we also looked again to Pfizer and Moderna about data around the protectiveness of those vaccines for the new variant. So the news on that front is developing, but it looks good so far. And again, I would hope that the potential for this would just motivate people who are eligible to get the vaccine to get it.
Great, thank you, Dr. Nefsi. I know that's, we'll keep a close watch on that and continue to provide updates as we know more. Bonnie, this next question is for you, and it's one of those logistical questions. This person is saying that we know that we have to actually monitor people after they get their vaccination for 15 minutes post-injection. So how are you doing that in a drive-through clinic? Are you having cars pull over into a different spot, like at McDonald's when your order's not ready?
Sort of, yes. And so what we do is once the vaccine is administered, we give specific details to the individuals in the car that they're going to drive around, and we have traffic controllers who put them in a spot, much like you would see at a concert. And they go into a spot, and we have observers who actually walk around and talk to the individuals in the car, and they are doing that face forward so they can see the faces. And we have a really catchy, slogan, honk for help. So much like a call button, much like a call button that you would have in the hospital or in a bathroom at a clinic, you very much just hit the horn and someone comes. And we really instruct those folks to, let us know if you're feeling something. And to date, we've had, really good experiences with this approach, and everyone is pleased and happy, and they read their morning paper, and then they're able to leave the venue. So it's worked out well.
That's great, Bonnie. And I'm going to ask Dr. Nefsey to comment on this as well, and just comment on the overall, are we seeing people have reactions? Has anything changed since last week related to the reaction?
Yeah, I don't think a lot has changed. Certainly with our employees specifically, we're starting to see a lot more of the second doses go in. And we did see a slight uptick in the number of elevations of side effects. Most of those were, my arm is sore. I just kind of don't feel good. I have some aches and pains, and some people with fever. So certainly slightly more side effects with the second dose than the first, but really nothing that's outside of normal, outside of what we would expect when we see that immune response kick in. We've had a handful of allergic reactions and those kinds of things that you would see with any vaccine, but nothing that's concerning us or having us, look at changing what we're doing.
Great. And Dr. Nefsey, this next question is also for you. I think there's a perception out there, because we may be doing these press conferences more regularly, that Munson Healthcare is getting all the vaccine and other places aren't. So the actual question is, do you know why you got all the vaccine you requested, but some health departments or doctors' offices or other places did not? Can you kind of talk to that process and how the allocation works?
Yeah, it's a good question, and I wish I knew the details. All I can say is we request vaccine at the end of the week, and then it is allocated by the federal government to the state, and then the state gets what they get, and then they allocate it out. I think that, in some of our more urban areas, there are multiple organizations, multiple health departments, multiple healthcare organizations that are requesting vaccine. Up here, it's basically us and the health department. I think there's a lot of concern about vaccine allocation and the equity, especially in rural areas. So it sounds like they're looking out for us. And making sure, since between us and the health departments, we're kind of it for Northern Michigan, they're just trying to make sure that we get enough vaccine that we can continue to distribute to the population. I don't know how that's going to change. There's been a lot in the news about releasing a lot of vaccine, about whether there were stores or not stores, whether we can pressure Pfizer and Moderna, to increase their production and allocate it. I think that we don't know yet what's going to happen with that, but we're hopeful that we'll continue to get as much vaccine as we can distribute. So I think once we can start to get into the rhythm, and we've got these mass vaccination clinics set up either through Munson Healthcare or through the health departments, and we can start to show, look, we can get this much distributed every day or every week. My hope, and I'm optimistic that the state and the federal government will give us the vaccine that we asked for.
Great, Dr. Nefsey. A follow-up question to that as well is, are you concerned at all about the receiving second dose shipments?
Well, like I said, it's all at this point has been a little up in the air. We have been very fortunate to receive our second dose shipments that we've requested. Again, that could change at any time. I do anticipate there could be some bumps in the road with a transition here between the CDC, the Federal Department of Health, all of that. But we're going to continue to advocate for our community and request as much vaccine as we can give between the health departments and Munson Healthcare.
Great. And I know that you and Bonnie and the rest of the Munson Healthcare Vaccine Task Force meet with the health departments daily, correct?
Yep.
Yeah.
Every day.
So it's a daily conversation of how do we help each other, right?
Yep, absolutely. And I think we are all, to a person, united in our desire to just get as much vaccine in arms of our Northern Michigan communities as we can.
I think Bonnie said it perfectly when she said, this is just how we do it in Northern Michigan. We all look out for each other. We're all friends and neighbors, and it's a little more personal up here.
Yeah.
Bonnie, this next question is, we're going to need you to clarify a little bit. This is coming in from one of our Facebook viewers.
Okay.
How can I be sure that my husband and I, who are over 70 years old, are registered to be notified? So can you please just explain
Yeah.
our process again? And then I'll also have, we'll bring up a slide at the end that shows all of the health department resources, and these are on our website as well. Because, and Bonnie, can you also, I'm asking a lot of questions, but can you also, if, which one should people pick? Should they pick Munson Healthcare? Should they pick the health department? Should they only pick one resource and keep trying that one? I mean, it's a little confusing right now.
It really is. And so as we evolve, I think it's becoming a little bit clearer, and it's because we are collaborating so closely with our health departments across the region. So most health departments across the region have their process in place. And I know that you'll show this in just a bit, but there's a resource called 211. And if you call that 211 resource, essentially a person will help you navigate this difficult process of kind of, where do I go? But what I can generally say is that your first point of contact is your county of residence. And so some people may not know that. So if you go to your county of residence, so if you live in Traverse City, you would go to the Grand Traverse County Health Department website. They have it outlined, their process of how I heard, sign up and get on a list. And so they have that list. So what we're doing is we're trying to coordinate with the health department, with the extra vaccine that we've been allotted, to try to vaccinate as many people as possible, and really kind of working together to determine what groups go next. So my advice is, look at your health department website, determine kind of their process. If they do have a list in place, you can certainly sign up there, or choose to stick with Munson Healthcare if you know that one of those age groups that you're in is going to soon be eligible. We ask that you just don't do both. Because if you do both at the same time, I think it creates some confusion, and that perhaps is one less dose that we can give out because there might be a cancellation or a no-show. So I would suggest, look at your health department first, kind of see their process. I know that we have a lot of great mass vax clinics that are being erected across the region by the health departments, and go there first. And if that's not an option presently, then check in with the Munson Healthcare website, and we have a lot of information on how you can sign up, or simply call based on your eligibility here.
Great, thanks, Bonnie. So again, please just choose one avenue maybe, and that will help eliminate some of the people getting on multiple lists and that. I know that's hard though, because everyone just wants to get signed up and,
Right.
and registered. And my father's 85 and lives downstate, and it's the same issue. I'm looking at the health department website, I'm looking at his health system website, and I'm trying to figure out which one do I do. And I finally just picked one, and that seems to be working really well, because I know now that it's sort of a little bit of an anxiety relief for me, because I don't have to look at multiple sources anymore. So,
and Diane, I just want to say, there's no wrong answer.
No,
there's no wrong answer to that. Just choosing one and sticking with it, and realizing that really we're all a big team and we're all working together to get you vaccinated.
Great. Yeah, thanks, Bonnie. So this is a question about the scheduling. If someone is not yet 65, but they're turning 65 this year, is there a way to pre-register for when their birthday comes around?
We've heard this question a lot. Unfortunately, right now, no. But that doesn't say in the future it won't evolve. But right now, presently, we ask that you must meet that eligibility criteria that we communicate out to the public. And then if you meet that criteria, then call the 935 shot. But please, just be patient, and know that we'll get to hopefully your age group soon, either the health department or Munson Healthcare, and we're just trying to work through that list as quickly as possible, but unfortunately not right now.
Okay, and if that does become an option, because we love to give vaccines on birthdays. In fact, there was a 99-year-old woman that came through the Traverse City Clinic on her birthday, and I know the team sang happy birthday to her, and she was wearing a tiara, and
It was
so
fantastic.
yeah,
It was
so
magical.
it was. It was a great story. Another question from one of our Facebook viewers, for Dr. Nefsi. After a person receives both vaccinations, so first dose, second dose, can they still be a carrier of COVID-19?
Yeah, that question keeps coming up. So the vaccine is 95% effective. So there is 5% of the population that could still get COVID and spread it around after their vaccine. It's 5%, but that's 1 in 20 people who that could still happen to. So it's not likely, but there is a possibility. And I would say it's less than being a carrier, so to speak. It's more that you could, 1 in 20 people can still get infected with and have COVID and spread that either knowingly, as a sick person, or unknowingly as an asymptomatic person.
Great, thank you. And I just want to address, I think I can address one of the questions coming in through Facebook as well about, my local health department doesn't have any scheduling available right now. And I think we just want to reiterate that the health departments are in the same boat as Munson Healthcare, where we're getting allocated certain doses, numbers of doses, and some of the health departments are only opening their scheduling back up when they know that they have vaccine available to administer. So every health department's going to be a little bit different. We mentioned this last week in our webinar with when they joined us for those discussions. They'll be back next week, and we can ask them additional questions if anything has changed. But Dr. Nefsi, that's still the case right now, right?
Yeah, absolutely. All of us are doing that. So, we are kind of waiting to schedule until we know we have vaccine, and then we're opening it up. And, that changes weekly and sometimes more frequently. So I would just say, to reiterate Bonnie's point of be patient and just continue to follow it. As soon as all of us are receiving vaccine, we're opening up the schedule, either more broadly or just to what it's already open to.
Right. I mean, I'm experiencing that. I just mentioned my father, who's 85. The same thing is happening downstate, where I have to kind of look at 8:30 a.m. when they open the scheduling back up and see if I can, win the Jeopardy thing and press the button fast enough to get on their schedule. So, Dr. Nefsi, this next question for you is, could you please remind everyone, if you have had COVID-19, if you've tested positive for it, how long should you wait before receiving the vaccination?
So it's a good question. Certainly, if you are actively ill with COVID-19, we would not want you to come get your vaccine or come to the vaccine clinic. And that's true really for anything. If you remember the screening questions, even for getting an influenza shot, they don't like you to be sick while you're getting it. So for sure, you would need to wait until your illness is over. And then anytime after that, it's actually safe for you to get the vaccine. That being said, we are in a state now where there's not enough vaccine for everybody. So if you've had COVID-19, you're actually pretty safe to wait until there's more availability. But that is a personal decision for you. And from personally, it is safe for you to get the vaccine after having COVID. There's no time limit. That 90-day time limit, originally we had discussed, that now is in place only if you've received convalescent plasma or monoclonal antibodies. That's a 90-day wait period. And I'll remind everybody also, there's a 2-week wait period between other vaccines. So if you waited to get your flu vaccine or you got immunized for something else, you need to wait 2 weeks before you schedule yourself for the COVID vaccine.
Great, thank you. Bonnie, these are a couple questions coming in about the process, again, through Munson Healthcare. At least I think this is for Munson Healthcare, because it could be for the health departments too. It might be different, but I registered over the phone. Where do I check to see when I can get the vaccine? And how do I know that I'm really registered? There's no online portal you can log into to say, okay, I'm in the queue. You just have to kind of trust the schedulers on the phone, correct?
Yeah, so that's a really good question. And so you are correct. If you call the 935 SHOT scheduling center, the schedulers are going to schedule you for dose 1 and dose 2. And so they will confirm with you dose 1 date and time and dose 2 date and time, and then also tell you where to go. And as Dr. Nefsi alluded to earlier, they will also be asking you those same type questions, so you won't have to remember, did I get a vaccine in the last 2 weeks? So they ask you all of those questions that would preclude you from getting the vaccine, and then they schedule you for both clinic dates. So I imagine this may be associated with the health department or a health department. Yeah, it sounds like that, because once you hang up the phone with us, you'll know dose 1, I'm scheduled this day and time, and dose 2, this day and time.
Correct, and I do believe, and we'll ask the health departments when we have them back next week, but I know that some of them have a website where you could submit your name and then they're going to call you back, but it's like, again, it's working a bit different in every situation. So thanks for that, Bonnie.
You're welcome.
Bonnie, can you also just clarify one more time? This question is coming in from Facebook. There are 2 of us who are 81, so I'm assuming they live in the same household. Can we sign up at the same time with 1 phone call, or do we have to call back twice?
We call those 2-fers or 3-fers. No, absolutely. If you're able to get in, and once you meet the eligibility criteria, so not quite yet, but very soon, once you meet that eligibility criteria, if you're both in that same household, yes, you can pass the phone around to that next person in your household. Just remember that you have to reside in that same household, and then you have to bring proof of, ID residency when you come to the clinic itself.
Great, thank you, Bonnie. I'm going to go back to Dr. Nefsi. There's some clinical questions coming in. We've received several questions about whether or not the vaccine is safe for those with autoimmune diseases, and if someone regularly receives allergy shots, is there any concern or interaction that might happen?
Yeah, there is no concern. The clear contraindication is anaphylaxis previously to an immunization. I will say there's a great FAQ or fact sheet on our website that talks about some of those questions, but having an autoimmune disease does not preclude you from getting this vaccine. I would invite you to talk to your primary care provider as well if you have very specific questions about your specific health history. But having an autoimmune disease is not a contraindication.
All right, a couple more clinical questions. Someone is saying that they received the vaccine due to their job role within the community, and then tested positive for COVID-19. So it doesn't seem like this vaccine works very well. And I probably has having to do with the time it takes to build immunity, correct?
Yep. So yeah, just to reiterate, it takes there's only 50% protectivity, if that's a word, after your first shot, and it's actually 10 to 14 days after your second shot that you reach that 95%. Even at 95%, which is actually really good for a vaccine, 1 in 20 people may still get mild disease. Now, what we know is that it does protect you from getting more severe disease. So, if you were to get COVID, if you were in that 1 in 20 people who didn't develop that full immune response, you're much less likely to get significantly ill with COVID. But it's not perfect. It's not 100%. But again, the reason that we are continuing to ask people to mask and social distance is, we are just now getting into the second dose for even our healthcare providers, let alone the general public. So, you are not fully protected until 2 weeks after your second dose.
Great. We still have a lot of questions, but we are unfortunately out of time today. We will go through these questions. A lot of them that have been coming in, whether it's through Facebook or through the webinar, they are actually addressed in our FAQ section on our munsonhealthcare.org website. So I invite you to go out there or have someone help you look through that FAQ to get some of your questions answered about what's in the vaccine. I've donated plasma. What does that mean? Again, infertility claims of the vaccine, all kinds of stuff that is addressed on our website. So next, I want to just share a couple more slides that just reiterate some of the resources we do have available. So again, the Munson Healthcare resource is 231-935-SHOT. And next slide, please. I believe we have a couple of the community resources out there. Bonnie mentioned the 211 Michigan. There's a phone number, or you can go to that website. There's the Area Agency on Aging of Northwest Michigan. Again, this information is available on our website. Next slide, please. We are closely working with Northwest Michigan Health Services. And again, each one of these health departments, the Grand Traverse County Health Department, the Benzie-Leelanau District Health Department 10, and Northwest Michigan, they all have different availability of vaccine, different processes for scheduling them. So please follow the instructions that each of these is giving you. Try to just choose one avenue based on where you reside and what might be easiest for you. And again, we are all collaborating to try to get as many vaccines out there as possible. So I want to thank everyone for joining us today. I want to especially thank Dr. Nefsi and Bonnie. Thanks for all the great work you're doing. And we hope to provide another update next week with the health departments, and we'll continue doing these until all the questions are answered. So thanks everyone, and have a great day.